Hey, we're at Dr. Crapo's office on Chatterton Way, just off Royal Oak, you know, where it comes close to the highway. And going to find out about something today that I have no idea. Holistic dentistry. I've never heard of anything like this before.
Well, it means different things to a lot of people. For us, it means taking the whole person, their function, what we see going on in their mouth, and evaluating that and making sure that we're not missing things that are slowly but surely causing problems in their mouth, even though if they don't feel it.
You're not just looking for specific cavities or rotten teeth or something?
That's part of a good exam, is to look at for problems, decay, things that are starting to fail, etc. But we want to also know what's the structure of their mouth, how does that work with their muscles, their joints, and so forth, and making sure that we don't miss things along the way.
Making Nancy nervous here. She's going, what? so how do you deal with what you see? How do you make this work?
Right. So a patient brings the symptoms. It hurts, it's swollen, it's bleeding, that kind of thing. But the doctor is looking for signs, wear, breaks, things that just don't seem right, and how the mouth works together. And so when he sees those kinds of things, he's got to be alerted and tuned to say, all right, yeah, we need x-rays. Now we need to take molds of people's mouths, like I've got here in my hands.
And this allows you to see what's working and what isn't working?
Well, we have a bite simulator. We've got something that helps us very much in knowing what's going on. And once we have the proper records, then we can study it outside when the patient has gone home and make sure that we're making decisions that will be helpful to her in the future.
So would you look at this and say, well, we're going to need to pull a tooth out and replace it with something, or do you go the braces route or something? I mean,
those are all part and parcel of the evaluation, yes.
Okay.
Sometimes crowding is extreme, and we need to employ braces, orthodontics. Sometimes it's a matter of aligning the teeth through crowns, bridge work, use of implants if there are spaces, and so forth. So we have to use the whole arsenal of things to do. So
this is, if I can paraphrase, it's not like a run and gun type thing. It's like dealing with everything that's going on and keeping an eye on it, and a follow-up dentistry situation.
Absolutely. So once we have these records, we have the folks back, and we have a nice sit-down talk for a half, 3/4 of an hour, and we talk about these things. And people now aware, they can give us their consent to go ahead and do something, and they're well informed.
Right. And they end up with beautiful teeth like Nancy's.
Yeah.
Show us the teeth, Nancy. They're beautiful. Wouldn't it be great if every patient came in looking like this?
Yeah.
Although you'd be out of business, I guess.
Yeah. But there's other things. Yeah.
It all works out in the end. Dr. Crapo, thank you very much for this.
All right. You bet.